Hi, beautiful people. The commonest infection to get as a pregnant woman is urinary tract infection. That is one of the commonest infections that can affect a pregnant woman. Normally, urinary tract infections are infections that affect the urinary system, which includes the urinary bladder, the kidneys, the ureters, and the urethra. So pregnancy can predispose a person to catching this infection very fast. Now, a pregnant woman can start having urinary tract infection as early as 6 weeks and as late as 24 weeks. And majorly because as the uterus gets bigger and changes with the baby's growth, it is very, very likely that the pressure can be mounted on the urinary bladder, so the baby can be pressing on the bladder, thereby causing the woman to pee too often or even blocking the path through which the urine can come out. If this happens, it is possible that it can turn that environment to an ideal place for a bacteria to go. Pregnancy also suppresses the immune system, so yes, it makes a woman susceptible to any other form of infections, including urinary tract infection. There are different types of urinary tract infections that even a person that is not pregnant can have. We have cystitis, which affects the bladder and the bladder wall. This is more like the inflammation of the urinary bladder wall. We also have pyelonephritis, which is the ones that can affect the kidneys. It's like an inflammation that can happen to the kidneys due to this infection I'm talking about. And then we have urethritis. The urethra is the channel through which urine comes out to the exterior. So inflammation of that particular organ is called urethritis. And we also have asymptomatic bacteriuria. So this asymptomatic one is the one that probably a person had the infection before they got pregnant and they didn't know that they had the infection. So it doesn't come with symptoms. That's why I say it's asymptomatic. You don't get to feel anything. But you know, pregnancy, like I said, can reduce the immune system and cause a person to be susceptible to infections. And with the growth of the baby, the uterus, and the pressure and the weight, the person can become symptomatic even if they've not been feeling this infection before they got pregnant. So how would you know you're having UTI when you're pregnant? If you're beginning to feel pain when you pee, a burning sensation or a lower abdominal pain, or hotness when you pee, you're seeing blood in your urine, you're having this increased urinary urgency, like you cannot hold your pee, you have to pee multiple times within the hour, and you're feeling pain when you try to do it. If you're not feeling any of these things, but your urine is changing color and it has a very strong smell, strong, unpleasant smell, then you might want to think about urinary tract infection. So how do you check for UTI in pregnancy? You can do urinalysis, and you can also do urine MCS or urine culture. These are the major two things. Or you can do a pelvic ultrasound as well. These are the major things that can show if you're having UTI while pregnant. For treatment and for management, you need to see a healthcare provider. There are antibiotics that are catered for people that are pregnant. You can't take anyhow antibiotics because you don't want anything that will eventually go back to affect your baby or affect you during your pregnancy. So if you are having UTI in your pregnancy, you don't need anyhow medication. You need to actually consult a gynecologist so that a right medication can be prescribed for you. To prevent UTI when you're pregnant, you must make sure you take at least 6 to 8 glasses of water every day. Make sure you use the restroom the moment you feel like going. Don't hold urine, don't keep urine. Make sure to pee before and after you do the do. Make sure you're taking your prenatal vitamins. What I mean is, you make sure you're taking at least 250 to 500 milligrams of vitamin C every day. Then 30 to 50 milligrams of zinc tablets every day. And lastly, make sure you're taking at least 25,000 to 50,000 international units of beta-carotene. So these are prenatal vitamins. You can also talk to your healthcare provider for other vitamins or let them know which other ones you're taking so they can direct you on how to, go about taking them, because you need these vitamins. Your immune system needs to be at its best so that you can avoid not just UTI, every other kind of infection. If you've learned one or two things from this video, please share it so that others can also learn. Thank you so much for staying through to the end, and I'll see you on my next one. Bye guys.